You said in a previous interview that we talked this morning that we're talking about systems, which is more important because in high impact, low probability events, we have the cascading effects, which are not only influencing one sector, it's going over to on many sectors. Right?
Yes, because all the sectors are interconnected. You cannot disconnect the economical sector from what is happening in the social situation, in the social sector, let's say, in what is happening in the health sector. For example, the pandemic, it was a health emergency, a health disaster, but it impacted economy all over the world.
Sure.
It impacted not only economy, it impacted everything. It impacted chain of supply, it impacted prices, it impacted availability of certain products. It caused delays in delivery of certain products, which had nothing to do with the health sector, but they were impacted, and that was caused by a health crisis. And then within the health crisis, which was for 2 years at least, let's say, within it, we had other crises which appeared and other situations which appeared. So we were just recovering from the pandemic, and Turkey had its own major disaster and its own major earthquake with a huge impact for the whole country. So a local disaster may not mean that the impact is local. It may mean the impact is national or even regional, beyond national. So we need to think of these issues. And as I said, we need to think out of the box and start preparing for such situations, and not only for limited situations with limited impact. I will give an example. When we used to talk about mass casualty incidents, we used to talk about bus accidents, train accidents. We didn't talk about hundreds or thousands of injured. But now we see that there were situations where we had not only hundreds of injured, we had also hundreds of dead in the situations. And these situations were either man-made or they were because of disasters like major floods and so on. Let's take the attack which took place, if I'm not wrong, in Las Vegas, where just one guy shooting from a high-rise building, he injured over 500 people. And those 500 people have to go to hospitals, have to be treated, have to be managed in a system which never maybe thought that they will have 500 people injured going to the hospitals, or to the hospital which is nearby. So these are situations which are of low probability. Luckily, they are of low probability, but once they happen, their impact is huge and of medium and long term, not of short term. And again, the pandemic, which we never thought it will happen the way it happened. Luckily, we had means to fight it. We had means to reduce its impact. We could create vaccines as humanity. We created vaccines very fast, relative with other pandemics. We created mechanisms to deal with it. But if we think at the beginning of the pandemic, the reaction was not the right one because we were not really trained about this. And the reaction was everybody to shut the borders, to say no more exports of medical materials, no more exports of health materials. We want to keep everything in our country. And even within the EU, the first weeks, they were more to isolate and to protect each country separately. And then luckily we woke up very fast and we said, no, we need to work together on this. And we need to approach this threat and this disaster, which is a slowly growing disaster, together. And I just give an example. We blocked exports of medical products, and we didn't realize that we were blocking the manufacturing of ventilators in Switzerland, of ventilation equipment for patients, for intensive care, because parts of those ventilators were manufactured in Romania. So by blocking the export, Romania didn't gain anything except that we blocked the manufacturing of the ventilators, which needed the parts that are manufactured in Romania. This was sorted out very fast, but we need to learn how to avoid such reactions and how to make things much better as a response, as a unified response, integrated response at the community level, at the national level, at the regional level, and why not, if it is a major situation like the pandemic, at the global level.
Yeah, and this would also support a faster recovery than we have seen before.
And a better one, because you can avoid certain issues when you are working with everyone to tackle the threat that we are facing. it's clear that we have better solutions, we have more coordinated approach, and we have faster, let's say, resolution. We have faster recovery from the situation we are facing, rather than working separately, each country separately or each community separately.